Welcome to my channel. Today's topic is hemophilia and I hope you enjoy this video. Hemophilia is a bleeding disorder where blood doesn't clot properly. Patients with hemophilia may take longer to stop bleeding after surgery or injury. While most commonly associated with humans, hemophilia also affects animals, most notably dogs, as well as horses, cattle, sheep, and even cats. There are three main types of hemophilia. Hemophilia A, also known as classic hemophilia, is the most common type, making up about 80% of hemophilia cases. It is caused by a lack or low level of coagulation factor 8. Hemophilia B, also known as Christmas disease, is caused by a lack or low level of coagulation factor 9. Hemophilia C, also known as Rosenthal syndrome, is a rarer form occurs due to a lack or low level of coagulation factor 11. Coagulation factors are proteins that are essential for blood clot formation. Produced by the liver, the coagulation factors are continuously released into the bloodstream. They are often called clotting factors. Common signs and symptoms of hemophilia include excessive bleeding from cuts, injuries, surgery, or dental work, large bruises, unusual bleeding after vaccinations, pain, swelling, or tightness in the joints, blood in the urine, and frequent nosebleeds without apparent cause. What makes hemophilia even scarier are the complications that come with it, which include deep internal bleeding, bleeding in the throat or neck, which affect ability to breathe, and infections. Hemophilia is often inherited, meaning genetics play a strong role in who develops hemophilia. It is typically caused by genetic mutations in the genes responsible for making clotting factors. In some cases, hemophilia can be acquired, but my channel focuses on congenital forms of the disease, so this will not be covered in detail here. Hemophilia is more common in males because the genes responsible for producing clotting factors are located on the X chromosome. Males with XY chromosomes develop hemophilia if they inherit one mutated copy of the gene from their mother, since they only have one X chromosome. Females with XX chromosomes can inherit a mutated gene on one X chromosome, but they still have an unaltered gene on their second X chromosome. And this helps prevent hemophilia. To develop hemophilia, they need mutated genes on both X chromosomes. Females who carry a mutated gene for hemophilia on one X chromosome are called carriers. They usually have mild or no symptoms, but can pass the mutated gene to their children, who may develop hemophilia. However, this pattern applies only to hemophilia A and B. As for hemophilia C, the situation is different. Since this type is caused by a mutation in gene that codes for clotting factor 11, which is located on chromosome 4, autosomal chromosome 4, it equally affects males and females. There is no racial predilection for hemophilia. It can affect individuals from any race or ethnicity. Currently, there is no cure for hemophilia. Before the 1970s, life expectancy for hemophilia patient was less than 30 years. However, advances in treatment since then revolutionized its management, and today hemophilia patients can live much longer, healthier lives. Hemophilia are usually treated through factor replacement therapy, which involves replacing patients' missing clotting factors by injecting or infusing genetically engineered clotting factors concentrates. Another option is gene therapy. It works by injecting copies of the gene that help the body make more clotting factors to prevent bleeding. Major challenge for the treatment is the development of inhibitors. Inhibitors are antibodies that make it harder to stop bleeding episodes because they interfere with the action of the replacement clotting factor. This was a quick overview of hemophilia. Next video is where it gets really interesting and complex. I'll be diving deep into the science and engineering behind hemophilia treatment methods. Like, subscribe, and leave a comment if you have any questions. Thank you.